Hey everyone, and welcome to this week's COVID-19 office hours. Grateful to have you all here today for these office hours, and we'll just do a very quick overview of some housekeeping and logistics slides before I turn things over to our team for the day today. So just as a reminder, we are in fact recording the office hours today, and we'll post a copy of the recording, the slides, and a copy of the chat content on the HUD Exchange. Just give us a couple business days, and we promise you it will be up there. We also just want to remind you that if you have any audio issues during the webinar, we have found that phone audio tends to be clearer and a little more consistent than computer audio. So my colleague, Tommy Jo, has just typed into the chat bubble for everyone a message that describes the way to connect to the phone audio if you need to switch to that at any point during our time together today. We will all be muted during the webinar today, but we hope to hear from you throughout through the chat functionality. So please send questions, comments, thoughts, feedback that you have through the chat message. Go ahead and look on your screen right now, and all the way over to the right, as you see in the red box, you should see what looks just like a chat bubble. If you click on that, it'll open up the chat functionality for you. When you are sending, again, those questions, comments, or thoughts back, please just take a quick moment and make sure that it is defaulted to everyone to make sure that both all attendees and the team that's guiding us through the content today can see all those questions and feedback as well. With that, I'm going to turn things over to Norm Suchar from HUD's Office of Special Needs Assistance Programs. Norm?
Thank you very much, Natalie, and thank you all for joining today after what I'm sure has been a long week for everyone. I want to quickly introduce who you'll be hearing from today. Again, I'm Norm Suchar from the Office of Special Needs Assistance Programs. You'll also be hearing from Marlisa Grogan from the SNAPS office. And going on to the next slide, we'll get our regular update from Emily Masitis from the Centers for Disease Control and Prevention. And we will also have some information from Barbara DePietro from the National Healthcare for the Homeless Council. I do want to just mention that I will a little later on have some quick updates on the point-in-time count and the continuum of care funding process. I know many of you sort of have joined just to hear those. We'll have those right after the presentations. So I'm going to turn things over to Emily to give us our COVID update. Emily?
Hi, everyone. Good to be back. I am resuming as the homelessness unit lead at CDC in the response. So I will give today's update. Next slide. So as I am sure everyone is aware, we've reached 9.5 million cases cumulatively across the United States as of yesterday, and we are in a pretty steep upward trajectory that started around the time of university reopening and is continuing as we head into colder weather. So community transmission is pretty high across the United States. Next slide. What I want to give you an update on today is actually that we posted ventilation guidance. I think that Lindsay had been giving some updates that it was on its way, and here it is. It's available now. It's under the Homeless Service Providers guidance on our website. So just if you go to our landing page and go to Homeless Service Providers, it's in kind of the middle of the page. There's a link on the right-hand side that will go directly to it. So I will just walk through it now and happy to answer any questions. So next slide. And the next couple of slides are actually just the guidance in slide form. But I want to start off with just a big picture overview of what we're really talking about when we talk about our ventilation guidance. So basically, people are going to be coming inside more because it's cold. And the thing that was helpful about people not being inside is that there's lots of airflow outside. There's more space available outside. So what we want to do here is make sure that ventilation inside is as good as it possibly can be, because that can help clear out COVID from the air and help reduce the risk of infection. There's kind of three components to the way that we think about ventilation guidance. One is that you want to have air flowing the second is that you want your air ideally to be flowing from the outside in as much as possible. And then finally, you want your air to be flowing through a filter if you can. So those are kind of the three chunks. And so I'll get into kind of this techy part a little bit, but if you think about those three pieces, that's really the main things to keep in mind. So if you go and talk to, an HVAC professional, just think about those three things. So basically what you want to do is make sure all your ventilation systems are operating properly and are not out of date and don't have any breakdowns in the system. Naturally, of course, the best ways to improve your ventilation are going to depend on your facility itself, based on how your facility is laid out and other environmental factors. And of course, where you are geographically makes a huge difference as well, in terms of how much outdoor interaction you can have. And as usual, we always advocate collaboration between the health department and homeless services. So please reach out for help there. So next slide. Some of the steps that you want to think through that still kind of fit into those three big things are to make sure you're using as much natural ventilation, indoor delivery of outdoor air as possible. The easiest, most obvious way to do this is to open windows if you can. Sometimes that's not possible, so that's when you want to think about other ways to increase your airflow. Just general increased airflow and air exchange is going to be a good thing. Improving your filtration is going to be a good thing as well. Make sure that you are maximizing your outside airflow, before people are coming into your facility if possible. And then what you want to do is just a general principle of infection control is go from clean to less clean airflow, so you're pushing unclean air out as possible. So next slide. If you are able to, think about using HEPA fans and filtration systems. Make sure that your exhaust systems in your kitchens are operating at full capacity. And again, kind of consider running those for a couple hours before and after space is occupied. And then finally, we have a consideration in here to think about using ultraviolet germicidal irradiation as a supplement to inactivate airborne viruses. This is not, our basics kind of say cleaning and disinfection and increasing your ventilation are good ways to do infection control. If you have the capacity, using this UVGI is another option to really double down on killing virus. So I think that's it. Next slide. Yeah, so that's it for me. Let me know if you have questions. I am not an expert on ventilation, but these pieces of guidance were written by experts. So I would be happy to either try to answer what I can, or we can get a hold of someone that can answer those.
Great. Thank you so much, Emily. And welcome back. And also, you may not be a ventilation expert, but you did sound one for that presentation. Thank you so much. Next, we're going to turn things over to Barbara DiPietro from the National Healthcare for the Homeless Council. Barbara?
Thanks so much, Norm. Sorry for the small font on this slide, but just wanted to talk about a webinar series that we're having at the National Healthcare for the Homeless Council. Today, we just had the first one, next Friday and the following Friday. And for the Game of Thrones fans out there, we're envisioning the combination of challenges that are either upon us now or imminently coming as this cascade of winter issues. And so to try to put our arms around a discussion, particularly around how health and housing and homeless services providers can collaborate, we're looking at flu and COVID together. How can we be doing campaigns effectively, reaching the folks that we're looking to reach who are particularly vulnerable right now? And then also I just want to do a quick reminder for staff as well, that if anyone is experiencing flu-like symptoms, whether that's COVID or influenza, please stay home. some of our masking and social distancing that we've all been doing right now is really going to be helpful in quelling the flu this year. But again, we just want to be mindful of the risks for all of us. And then, frankly, too, we just, next Friday, we're looking at the natural disaster combination of cold weather and disasters, fire and hurricane, and then how we can be preparing and planning for those to the extent possible. How can we share examples of communities where they're leveraging federal or local funds, how they're working with area partners. And then also, I just want to mention that folks from the HUD TA team will be coming to talk about the new winter guidance for shelters and strategies for overcoming the challenges we know are upon us from our decompressed shelters right now. And then third, we're looking at our man-made disasters of evictions and social upheaval, and really want to talk about how can we be getting out ahead of the wave of evictions that we're anticipating, how are we preparing and preventing that to the extent possible, and then how do we reflect on the structural racism and some of the social upheaval that we're having that's taken a vicarious trauma on many people or direct trauma on others, both our staff and the clients that we're serving. So we do just want to put a structured conversation around how we're all addressing this and then how our collaborations together can make having a stronger response at our local level better. So with that, I just wanted to promote these three things. If you missed today's, you could always get a recording sent to you, and then I put the registration link here on the slide, and I'll put that in the chat box just now. So with that, I'll turn it back to you, Norm. Thank you.
Thank you so much, Barbara. And just, I can't recommend enough NHCHC's webinars. So very looking forward to this series. Thank you so much. So next I want to turn things over to Marlisa Grogan. She's going to talk, she's going to highlight some resources that we've had up for a while that I think are really important during the eviction moratorium and the times we're facing. So with that, I'll turn things over to Marlisa. The floor is yours.
Thanks, Norm. Hi, everybody. Good to be with you today. We've got the ESG homelessness prevention eligibility during eviction moratoria resource linked when you're able to access these slides once they're posted. And although I'm not going to go over that document in detail, I'm going to be referencing some of the key eligibility requirements that are included in that document, and then also just wanted to put in a plug for it since I think everyone can benefit from a reminder about the full expanse, the full range of eligibility criteria that can be used to qualify households for homelessness prevention assistance, and then just noting that we're going to be talking narrowly about two ways to qualify, which are directly related to landlords or property owners and eviction actions. So with the next slide, we'll start off talking about just an overview of the CDC moratorium, and this material is just, readily available to everyone. It's just putting in bullet form the materials provided by the CDC in their FAQs posted on the CDC website. But in general, the CDC moratorium temporarily halts residential evictions for non-payment of rent during the September 4th, 2020 to December 31st, 2020 timeframe. And the order defines eviction as any action by a landlord, owner, et cetera, to remove or cause the removal of a covered person from a residential property. And we'll talk about how a covered person is defined in a second. But the eviction moratorium order doesn't prevent landlords from starting eviction proceedings. And the qualification there is that the actual eviction can't take place during the period of the order. The order also does not terminate or suspend operations of any state or local court. So that's another important element to note. Next slide, please. So any tenant, leasee, or resident of a residential property who provides a landlord with a declaration form is considered a covered person. And I'm going to go over the criteria that are included in the declaration form right now. And the declaration form essentially certifies that an individual has made efforts to obtain all government assistance for rent or housing, so they've made their best effort to attain other assistance related to rent or housing. They're also certifying that they're not expecting to receive income exceeding $99,000 or $198,000 for a joint return in annual income for calendar year 2020, and also, or they have not been required to report income in 2019 to the IRS, or they have received an economic impact payment. They're also certifying that they have experienced a substantial loss in income, compensable hours of work or wages, a layoff, incurred an extraordinary out-of-pocket medical expenses resulting in the inability to pay full rent or housing payment. And the declaration form actually defines what extraordinary is how it's defined in terms of the overall percentage of someone's annual income. Next slide, please. The declaration form also requires the covered person to certify that they've made their best effort to make timely partial payments, that they're likely to become homeless or live in a crowded or congregate living situation if they are evicted. They also need to acknowledge that the terms of the lease or other similar contract still applies. So this means that the CDC moratorium does not get anyone out of late fees, penalties, interest, or any other terms of the lease that they're already signed, they're already agreed to in that document. And they're also acknowledging that at the end of the eviction, namely December 31st, 2020, the landlord can require payment in full for all rent due, and that failure to pay could result or may result in eviction in accordance with state or local laws. Next slide, please. So what does this mean for ESG homelessness prevention eligibility? The two ways to really qualify for homelessness prevention eligibility when it's directly pertaining to a situation where someone's facing an eviction action that's been initiated by a landlord or a property owner is the homeless definition category 2 or the at-risk of homelessness definition category 1C. So for the homeless definition category 2, acceptable documentation includes an eviction notice, a notice to quit, terminate, a demand notice. In other words, documentation that shows that there's a reasonable expectation that the tenant is going to lose their residence within 14 days, that they are going to be physically removed from the residence, that they're going to be literally homeless within that 14-day period. So the earliest time to qualify is 14 days prior to the end of the moratorium, December 31st. And that is if the landlord starts the eviction action, has all of the paperwork in place, the court, the court documentation, and that come January 1st, 2021, the resident or the tenant is going to be removed from the residence. A really important thing to remember is that even if you do have that acceptable documentation, an eviction notice, a notice to quit, or other forms showing that there's a reasonable expectation that the tenant will lose their residence within the 14-day period, they also have to meet the income criteria. They all need to substantiate that they have no resources or support networks and no subsequent residents identified, which are the other eligibility criteria for Category 2 of the homeless definition. Next slide, please. And the other way that I mentioned is at risk of homelessness, Category 1C. So that's Category 1 of the at risk of homeless definition with the risk condition identified in paragraph 3C, which is that the household has been notified in writing that the right to occupy their current housing or living situation will be terminated within 21 days. And acceptable documentation has to show that the household's right to occupy will be terminated within 21 days, not that they're necessarily going to be required to leave the unit within 21 days, and that's the big difference between this eligibility criterion and the homeless definition category 2. However, and this is the big but, the above documentation is not enough to render someone eligible for homelessness prevention assistance, because the household also needs to show a lack of resources and support networks and their income qualification. So, HUD considers the CDC moratorium protections as a resource or a support network preventing eviction. So, for that reason, both this way to qualify and homeless category 2 are not on the table during the eviction moratorium. Next slide, please. So if someone is covered by the moratorium, meaning they signed the CDC declaration form, I'm going to reiterate this again, they're not eligible under Category 2 or Category 1C, because in both situations, the CDC moratorium is considered a resource or support network. In addition to that, Category 2 is also not a way to find someone eligible, because they will not be evicted. They will not be removed from their unit within 14 days because for non-payment of rent for someone who's covered under the moratorium. We know that there are many, many different situations and cases that you're encountering on a daily basis. If you're unsure about how to make an eligibility determination, if you feel like you have special circumstances, please submit an AAQ, and we can look at the details of your situation. Next slide, please. And then finally, what should a program participant do, or what should a tenant do, or what should you do if you encounter someone who is covered, who signed the declaration, and they still receive an eviction notice for non-payment of rent, or a court order that's basically confirming that they are going to be evicted within 21 days or 14 days or within a certain time period. We're recommending that they reach out to their case manager as soon as possible, that they or you as a provider or legal counsel inform the landlord that although the CDC moratorium does not prevent them from starting the eviction proceedings, the actual eviction cannot take place during the period of the order. And then finally, seek legal assistance, and we've linked to some free legal resources on this slide to see if you can, if program counsel can help. I'm sorry, not program counsel, that's our legal assistance, but if you can find legal assistance to help you through the process if a landlord is proceeding with an illegal eviction action. If all else fails and you know that someone is going to be evicted, someone's going to be turned out of their unit, they do qualify for homelessness prevention assistance. So we are just acknowledging here that due to your best efforts and due diligence, if someone is going to be evicted or a court has made a determination or the landlord is just proceeding with an illegal eviction action, that tenant would still be eligible for homelessness prevention. Next slide, please. Before I turn it back to Norm for the Q&A, we just wanted to remind everybody that the economic impact payments are still, they extended the deadline. So if you still have program participants or clients who can benefit from this really important resource, go to www.irs.gov/EIP non-filer so that they can make use of this benefit that they're eligible for. And the deadline, as so colorfully noted on the slide, is November 21st. So please don't forget that. And with that, I will turn it back to Norm.
Thanks so much, Marlisa. We've had a couple follow-up questions about the CDC eviction moratorium and eligibility for ESG, homelessness prevention assistance. So I just want to talk through a couple of those. One question that came up is, there's the CDC eviction moratorium, but many states also have additional eviction moratoria. Does the CDC eviction moratorium supersede state eviction moratoria, or how does the relationship between those two work?
I actually remember reading in the CDC FAQ document that if there is a state moratorium in place that is more stringent than the CDC eviction moratorium, then that state implemented moratorium would have precedence.
Great, thank you. And then we have a question about, so obviously some of these things get a little murky, but if a landlord is proceeding with an eviction illegally, or I guess, like, not to be sort of lawyerly about it, but they're still going ahead even though somebody's covered. You said that people would be eligible for prevention assistance. So does that mean they should be getting, what kinds of prevention assistance are they eligible for in those cases?
I mean, I think that the first thing to turn to would be legal assistance. So you could pay for legal assistance under homelessness prevention to try to prevent an eviction from proceeding. So that would be, the first go-to thing. But I guess ultimately, if someone is going to become literally homeless in the short term, within 14 days, even if a landlord is doing that illegally, we would not consider the household ineligible for assistance because the landlord isn't supposed to be doing what they're doing.
Yeah, and there is a reasonable test there's a reasonableness test to all federal funding, I think, but certainly to the ESG program. And so, I think the expectation is you're doing the things that would sort of more efficiently get to resolution of the housing crisis, rather than, I think if someone were to then want to provide 12 months of rental assistance when, sort of legal assistance and would have sufficed, I think, that would probably not pass the reasonableness test there. So, and then there were several questions about what about people who are not covered by an eviction moratorium? So people are being evicted for reasons other than, and actually I'm going to turn this question over to William because I know you've been working on eviction moratorium stuff. But Marlisa talked about the eligibility criteria here, but what if somebody's being evicted for a reason other than non-payment of rent? How does the homelessness prevention program and the ESG program work in those cases?
So the shorter answer is it does work, right? So if there is an eviction notice and they otherwise meet all of the definitions as laid out by Marlisa, you can proceed with homeless prevention, and we certainly encourage you to do so. And that covers quite a few people. So Marlisa's overview is really helpful in understanding that there is a large group that could be receiving homeless prevention right now, and you just need to see what is in play in terms of what's driving an eviction.
Great. And I think one sort of important thing to note here is when you look at data on who becomes homeless, the evictions for non-payment of rent are certainly a part of that, but not actually the biggest part. Most people are evicted from doubled up situations, or they're leaving institutional settings, or there's conflict in the household, or they're fleeing violence, or things like that. All of those instances, people are certainly eligible for either prevention assistance or just eligible under the homeless definition. And then we had another question that I wanted to ask about, which is, so in a scenario where the eviction moratorium ends in, say, at the end of December, and a landlord is proceeding with an eviction, and somebody has, built up some back rent, how much can you? And Marlisa, sorry, I'll turn this question over to you. How much can you pay for to cover their rent?
So the ESG homelessness prevention cap would be, well, actually it's the same cap for rapid rehousing and prevention when it comes to rental arrears, but it's a 6-month cap. So that's the maximum that could be provided under the ESG program.
Great, thank you. And are there other costs that can be, back costs that can be covered besides rental assistance?
You could also, well, actually, now I am just double checking myself. Yes, utility arrears could also be paid if those utility arrears are putting the household at risk of homelessness.
Great, thank you. Emily, we had a question about electrostatic decontamination. So one of the questioners asked whether, mentioned that some of their shelters are using electrostatic decontamination. Can you talk about whether that's effective, and would you recommend that for shelters?
Sure. So electrostatic decontamination is really when you, so compared to what you might normally do, which is, use a cloth or a disposable wipe to apply bleach or a similar disinfectant to a surface, an electrostatic sprayer takes a disinfectant and it sprays it in such a way that it gets a really even coat of the disinfectant on a surface. I would say that for the most part, doing your normal disinfection is what we still recommend. If you're going to use electrostatic disinfection, make sure that you're using the right chemical in it. So an EPA approved chemical that kills SARS-CoV-2, bleach is a good example of that. And then I think something really to emphasize, though, is that we still don't think that surfaces are the primary way that SARS-CoV-2 is transmitted. So if it comes down to a question of resources, focus on your standard, enhanced cleaning that you're doing, and then focus on things like increasing space between people to prevent more of that close contact, because we know that there's a lot of transmission by close contact versus surface transmission, which probably comprises a lower level of transmission. So if you have the resources, then, it is possible to use an electrostatic sprayer.
Great, thank you very much. I have a couple, I mentioned earlier that I would give a couple quick updates, so I want to do that now. One of the updates, so I want to start with a quick update on the point-in-time count and sort of what our plans are for the point-in-time count that's coming up at the end of January. So I will say we do plan on putting out much more guidance about this. But I want to give people a heads up because I know everyone's in the middle of planning and trying to figure out exactly what they're going to do. So just to start out, obviously there are 3 parts of the point-in-time count. There's the housing inventory. That will proceed as normal. Everyone will be doing the same housing inventory count that they normally do. There is a sheltered count and all this sort of data that's submitted with the sheltered count, and that will just happen as it normally happens, and we'll be collecting the same kind of data. We will have some more guidance about non-congregate sheltering and how to sort of count people in non-congregate sheltering. but that's going to be fairly normal. I think everybody's question is really about what about the unsheltered count and what are we going to do with that. So we know that there are a lot of challenges with doing the unsheltered count this year. Most pressingly, there are volunteers. It's just much harder to get volunteers than in a normal year. And also that there are obvious and really important concerns about preventing the spread of COVID during a count. So we will be, for any community that wants to do an unsheltered count and is prepared to do a full unsheltered count with all the data collection and stuff, that is going to be fine, obviously. We will be providing some guidance about how to do so safely to prevent risk of COVID transmission during that process. But we will also provide a process for opting out of certain parts of the count or doing sort of alternative approaches to the count. I think it's hard to describe in an update like this sort of the whole scope of that, so I'm not going to try, but I will say we will sort of provide some flexibility around the types of data that is collected and sort of the approaches you take to collecting data. And so that may mean just, submitting less information about demographics, or, using different sort of sampling approaches or partial count approaches to doing the unsheltered count. What we're going to ask is for you to, let us know what the challenges you're facing are, and, what kind of, what alternative approach you would like to take. Again, we will provide a lot more specificity and guidance about that. We will also have a lot of technical assistance around that. So if you're considering a sampling approach, for example, we will provide some technical assistance to help you sort of identify exactly how to do that. As far as the timing of the guidance, first of all, this is going to come out in not all at once. It will there will be different stages of this, but I expect it to, I think we'll have a lot more clarity probably by the end of next week or early the following week, as far as sort of what everything, all the stuff that's going to be in there. The notice is probably going to be 2 or 3 weeks from now, and there will be other types of guidance that will be sort of in between there. So that's roughly the time frame. Again, sorry I can't provide more information, but I did want to sort of get everyone prepared for if you are looking for an alternative approach, we will have an option for you to tell us what your alternative approach is and why you need it, and to use different approaches. And again, that can be around the different sampling approaches, or the timing, or the data you're collecting. We will also let you know how to let us know about those things. So that's a quick update on the point in time count. I want to give a quick update about the COC funding process as well. So just to set the background here a little bit, normally our statute requires that we run a full COC competition. And so we can't sort of by ourselves decide we don't want to run a full, NOFA in competition. However, those of you who have been following legislation in Congress, there are obviously some bills out there that would allow us to do essentially a renewal process. So assuming one of those approaches passes, and what we hear is that that's looking like a December timeframe. If that language passes, the way we would do this is we would essentially publish a list of grants, and there would be no real application process. People wouldn't have to submit to anything to us unless the list of grants we published had some problems in them. So, like there was a grant missing, or the amounts were wrong, or something like that. And we would provide a process for you to sort of reach out to us, let us know that there's a problem, and and, we could, whatever we need to do to resolve it, and we could make awards shortly after. For planning and UFA grants, they would essentially happen like they normally do. So there really wouldn't be any changes there. We would not have opportunities for reallocation. Oh, I see someone asked a question in the chat window. You would not be able to do reallocation. We have had some people ask about reallocation, and in some of those cases, it's pretty clear that there are other ways to address the things that were needed, that were sort of necessitated the need for reallocation. So if you had planned on doing reallocation and are concerned if you wouldn't be able to do reallocation, we urge you to reach out to your field office or to your SNAPS contact to talk about what it is you were needed to accomplish, and we can sort of jointly problem solve and see if there are other approaches that could solve those problems. Also want to mention that we did publish grant inventory worksheets a few months ago. I don't remember the exact time frame, and people gave us information about those. And we have the current grant inventory worksheets published. If there are problems with those, again, it would be helpful if you could reach out to your field office and just let them know what the problem is. Maybe a grant's missing, or maybe amounts are wrong and you didn't catch it the first time, or something's changed since you had those conversations. So that would be very helpful. So those are the updates I have. I don't have an update on the YHDP NOFA, unfortunately. We will certainly let you know as soon as we do have an update there. So Marlisa, I wanted to direct the next question your way. We have a question about warming centers, and people are asking for any additional comments we could have or recommendations we have around warming centers. Can you talk about sort of considerations with respect to warming centers? And also, Emily, if you have some suggestions for people who are looking at setting up warming centers, that would be appreciated as well. So Marlisa, any thoughts about how people should think about the topic of warming centers?
Sure, and I'm going to take this opportunity to plug our winter shelter guidance and planning tools that are posted on the HUD Exchange. But, while you're taking the opportunity to plan for opening up warming centers or other overflow shelters, it's an ideal time to be able to use those tools as sort of a guide in thinking through like the type of infection control measures you want to put in place, how the type of program model you want to organize, and how you want to carry out that warming center project. But I'm sure Emily's going to touch on some really important infection control measures, but then also how you're going to coordinate that among other various stakeholders, like what type of criteria you're going to need to think through about when to open the warming center, other stakeholders that you can contact when you open a warming center, like what would the temperature be, or other weather conditions to trigger the opening of that center. So there are a number of operational and programmatic considerations, but I highly recommend you check out the winter shelter planning information to just make sure you're going through all of those wickets, and then also connecting with the various stakeholders within your community to make sure that you're using the resources and the capacity that they have to offer, but then also cluing them in to the fact that this warming center is going to be a resource in your community.
So yeah, I can also
Great.
jump in there. Oh,
yep.
I was just going to jump in. Sorry, Norm. And just say that, Marlisa, you pretty much covered it all. The only thing I would draw attention to is the infection control tool that we have that we can walk through if you are setting up a warming center or an overflow shelter. We can walk through kind of the guidance to just make sure you've got every place. If you need that, or we can link you up with the state or local health department to do that. So we can be a resource if you need it.
Great, thank you very much. Additional questions. So we have a great question about doing sort of gaps analysis that's meaningful in this time. William, I know you answered this in the chat, but I think this is a helpful topic for everyone. Can you talk about how, like, resources to help people do a good gaps analysis to really understand how they should be deploying the resources they have available?
Yeah, I love that question. I think the key resource that I put in the chat is the Estimating Future Homelessness resource. It gives you space to put in all kinds of inputs. And again, the tool is as good as the data you put into it. So the more data you have, the better you will be able to understand your own analysis. HUD doesn't pre-populate it, but we have a space for you to kind of understand where to get some of that information, and then some of it you have to get on your own. But the core purpose is for you to be able to consider things like unemployment, eviction rates, current usage of existing shelter, other options, permanent housing options. Take all of those factors into account, layer in the COVID case piece, and get a sense for what you might expect in terms of the next couple months so that you can plan accordingly. And there are other resources that kind of talk about this, but I think just focusing on that one resource is probably most helpful for you to be able to do kind of a hands-on planning effort.
Great, thank you very much. So let's see, we have a few questions here. Any word on HUD issuing guidance pertaining to monitoring? I'm going to assume this is for the ESG COVID funding. Marlisa, do you have a sense of what the timing is for our monitoring approaches?
Well, we are working on updated monitoring exhibits for ESG CV, and we typically recommend that recipients look to the CPD monitoring handbook for sort of like the gold standard for monitoring. So recipients can look at those exhibits to prepare themselves for a monitoring visit, but there are also exhibits specific to subrecipient monitoring, which will also be updated, and recipients can reference that for, just good questions to look at when they're monitoring their subs, because that's essentially what HUD will look at to make sure that subrecipients are getting the oversight that they require.
Great, thank you. So I think those are all the questions that we're able to answer now. A couple of these I think we'll want to take back and answer in a future version of office hours. I also want to mention that, a lot of people submitted questions to us in the chat window, or not questions, but suggestions for technical assistance products. You gave us in the chat window yesterday. That was great feedback. We are working on a lot of that stuff. And so definitely planning to have more information about those topic areas in the future. So thank you so much for that. I do want to thank everyone for participating in the webinar today. I want to thank Emily and Barbara for giving us great updates. Emily's update was a little depressing in some ways, but very, very important information. And Barbara, the webinar series is great, so thank you so much. I want to thank our technical assistance providers, and I want to thank you all for joining the webinar today. Hope you all have a great weekend, and look forward to seeing you in a future webinar. And that concludes our session today.